Ladies and gentlemen, dear audience, honorable jury members, and dear opponent. Greetings. Today, the House and I are here to discuss a topic of such a matter, which is the government should take sole responsibility in fully financing healthcare services in order to guarantee a comprehensive and equal healthcare access. First and foremost, let's tackle the definition. Healthcare is not merely a commodity, but a fundamental human right. Every individual deserves access to quality healthcare services, regardless of their socioeconomic status. It's a basic requirement for a dignified life and should not be contingent upon one's ability. By taking sole responsibility in fully financing healthcare services, the government upholds this essential right for all citizens. Access to healthcare should not be a privilege afforded only to those who can afford it. When healthcare is privatized or inadequately funded, marginalized communities, low-income individuals, and vulnerable populations often suffer the most. A government-funded healthcare system ensures equitable access for everyone, reducing disparities and promoting social justice. Healthy citizens contribute significantly to a nation's boosts for economic and growth. And when healthcare is readily accessible and affordable, individuals are more likely to seek timely medical assistance, leading to healthier and more productive workforce. This, in turn, fosters economic growth and national prosperity. A government-funded healthcare system promotes... Yes?
Can you provide examples of countries where a fully government-funded healthcare system has consistently demonstrated success in terms of quality, innovation, and patient satisfaction?
I'm going to talk about this in my second intervention, and I'm going to present more examples like Germany, Sweden, Norway, etc. A government-funded healthcare system promotes social cohesion by fostering a sense of solidarity among citizens, knowing that everyone has access to quality healthcare services without any financial hardships, builds a stronger sense of community and unity, thereby reinforcing the social fabric of the nation. From an ethical standpoint, ensuring healthcare access is an essential component for a compassionate society. It reflects a nation's commitment to the well-being of its citizens and stands as a testament to its humanitarian values. It's the government's duty to protect the most vulnerable members of society, and providing comprehensive health care is a pivotal part of fulfilling this obligation. In conclusion, by taking sole responsibility in fully financing healthcare services, the government not only fulfills its moral duty, but also fosters a fairer and more equitable society. It underscores the principle that healthcare is a right and not a privilege, setting the foundation for a healthier, more prosperous, and morally conscientious nation. Thank you.
First, to respond to the Prime Minister, solidarity can't be if everybody pays. It will only be if the rich pay while the poor pay less or nothing at all. Dear opponents, esteemed audience, and respected judges, greetings. I am delighted to stand in front of you today to do what I've been dreaming of for so long. I am even happier knowing that our House will guide and enlighten you through today's debate by convincing you that our position, which is the government cannot take sole responsibility in fully financing healthcare access, is the right one. To do so, we, the opposition team, are going to follow a clear structure. First, our deputy leader of the opposition we'll talk about healthcare access in third world countries and how these could never afford free healthcare for all its citizens by giving second-hand evidence. Then, our member of the opposition will show that even developed countries don't fully fund healthcare services and refer to the uses of money earned from hospitals. And to conclude, our rep of the opposition will talk about services in public hospitals and the advantages of privatization. Now, allow me to present my first argument. Our House firmly believes that a balance in financing healthcare access is necessary to reach equal healthcare access. One way to achieve this balance is by implementing a proportional system in which the rich pay more while the poor pay less or nothing at all. Moreover, the government should adopt privatization accompanied by insurance. Therefore, the government should supervise the private sector to keep a check on the fees that can sometimes be too high. And every citizen must have access to healthcare insurance to finance their medical services. This is not only fair, but also essential for the development of any nation's economy. Some may argue that requiring people to pay for healthcare access is cruel. However, we must face the reality that without proper funding, the healthcare services cannot be sustained. A healthcare organization emphasizes the healthcare services should be accessible. You, dear opponents, claim that we are in taken.
Is healthcare a right or a business platform?
It is a right, but we must be realistic. How could a government, we're talking about rich or poor countries, how can a government fully fund healthcare access to all its citizens? It is absolutely impossible. So I'll invite you to stop being a bit unrealistic and focus on reality. So I was saying that the World Health Organization emphasizes the healthcare services should be accessible. You, dear opponents, claim that we are inhuman while you are the soft-hearted ones. But aren't you devastated by seeing people dying in rural areas because the government could not afford enough hospitals for them? This clearly indicates that the government needs support from the private sector. We said that the healthcare services should be affordable, accessible, and of high quality. High quality, not the first thing that comes to our mind when we picture a public hospital, right? All what I mentioned is that the government should adopt privatization accompanied by insurance. And it is what we, the opposition team, are defending. Thank you.
Ladies and gentlemen, esteemed panelists and very distinguished guests, I stand before you today to advocate for a fundamental shift in our approach to medical health care, a paradigm where healthcare services are fully funded by the government. This is not merely a matter of policy, but rather an ethical imperative that addresses the very core of our societal values. Let us first and foremost think about the honest conviction that we as a general public and as a society bear towards our countrymen. Is it not our obligation to guarantee that every single person, no matter what their financial status is, approaches quality medical care? Logically, I inquire, should the right to health be a universal entitlement that transcends financial barriers rather than a privilege reserved only for the wealthy? Okay, imagine a scenario where a child born into a low-income family is denied life-saving treatment only because their parents cannot afford it. Is this the society we aspire to build, where the destiny of our youth is simply determined by the thickness of our parents' wallets? This is a fundamental injustice that can only be rectified through a comprehensive, government-founded system. Now, if I may bring my point of view into this, I think it is only common sense that we establish a globally recognized and truthfully verified fact and reality, a reality which would be very easily agreed on as long as you, whoever you are, claim to be sane-minded, due to the matter's evident and simple state of flagrancy. I mean, is it not undeniable that healthcare costs can be very often the source of economic inequality, pushing individuals and families into financial turmoil? Government-funded healthcare is here and acts as a safety net, preventing the catastrophic consequences of medical expenses. To make it clear and simple, when basic health needs are met, individuals can pursue education, employment, and contribute more effectively to the economy. In essence, a healthy population is naturally a more productive one. As the degree of importance of this reason I've just given is pretty high itself, I'll make sure to go more into details and explore it more so we can together comprehend why the catastrophic disaster of poverty can be qualified as an evidence what my house and I are supporting. Let's first start by demonstrating how the world would be 1,000 times better if the clothes we are holding up for was to be ultimately applied. For that, I invite you all to take a closer look into what WHO, the World Health Organization, has presented in a video of theirs that you can, by the way, for reference, find in their official website. What they have advanced is very simple. I cite, 2030. It sounds like years away, but the clock is ticking. Time is short, and we have a promise to ensure all people and communities in all countries receive the health care they need when and where they need them without facing financial hardships. But there's still a lot of work to do. At least half of the world's population... Okay.
Do you believe that the private sector has no role to play in healthcare? And if not, how do you envision a collaboration between the public and private sectors to ensure a more comprehensive and effective healthcare system?
Well, to answer your question, what I have advanced in my presentation is just the answer of what you just asked, because it's poverty. Poverty is what pushes the government to fully fund those expenses. Okay, as I said, at least half of the world's population still lack full coverage for health services. More than 800 million people spend over 10% of their family budget on health services, and close to 100 million people are pushed into extreme poverty because of healthcare expenses. We cannot accept a world like that. We cannot afford a world like that. We call on the global community to make universal health a political priority, so everyone can access quality healthcare without facing financial hardships. If we work together, we can make healthcare, we can make universal health coverage reality and ensure a safer, fairer, and healthier world for all. This right here, as beautiful and as an inspirational message it is, accused poverty, which in the case provoked... Thank you.
Dear opponents, respected judges, esteemed audience, greetings. Here I am, standing before you. My hands may shake, my legs may tremble, my voice may quiver. It might appear a sort of fear has taken hold, but let me assure you, today, behind these physical manifestations lies a quiet strength. I'm buoyed by the confidence in our debate team, which is grounded in realistic perspective to the discussion. We've been busy working to ensure that our arguments reflect the complexities of this discussion, providing a solid foundation for our stance. On the other hand, it seems that the government team may be embracing a more idealistic or perhaps less grounded perspective. While diverse viewpoints enrich the discourse, I believe that a commitment to realism is vital for a meaningful debate that addresses the challenges we face. Well, dear audience, allow me to fortify this point, and I would ask you to think about one random country. Well, most of you will probably think about our beloved homeland, Morocco. It has earned its place as one of the more advanced countries, securing the second spot on the continental scale after South Africa. However, on the global stage, it's quite undeveloped and progressive. It holds the 101st position. Excuse me. Complicating this landscape is Morocco's population, estimated at more than 37 million people in 2023. The sheer size of its populace poses additional considerations for a nation already struggling with economic complexities. Yes, exactly. Financially, Morocco faces a daunting scenario with its debt that reaches $91.1 billion in December 2022, increasing every time, and currently the economy of Morocco has officially reported as having a debt to GDP ratio of 17%, indicating Morocco's debt level for $101 billion, which is a lot. And well, to not talk a lot, that is to say that fully funding healthcare services by the government requires a lot of money, dear opponents. The challenge is that the government should juggle and balance its tight budget between among important areas such as education, infrastructure, and social welfare. With limited funds available, allocating a big chunk of the budget for healthcare becomes, well, difficult. The government's ability to fully pay for healthcare services is restricted by the need to manage various economic priorities, leaving little room for extra spending. This challenge echoes across every economically disadvantaged nation.
POI.
Yes?
Is that the
mirroring the struggle faced by countries grappling with limited resources, especially in the well-known dark continents, our continents, such as Algeria, Tunisia, Egypt, Madagascar, and the list is still long. And well, dearest opponents, if you're still stubborn enough to think that the government can fully take charge of healthcare services while he is always struggling with economic complexities, then I strongly urge consideration, as they may be a need for a reality check. Thank you.
Ladies and gentlemen, I think I'm not teaching you anything if I tell you that the Moroccan population is increasing exponentially, which means that every time it increases more and faster. And who says more populations says more expenses, and who says more expenses say obviously more money. And here comes the problem, as the repartition of the funds dedicated to the healthcare industry is not clear at all, as the public sector receives 60% of $4 billion and the private one 40%. And even if 60% of $4 billion still represents $2.4 billion, that's not enough, as it didn't satisfy the population needs. As well as the remedy that was placed to actually satisfy the habitants' need did not work at all and just created more frustrations for the deprived ones. And all of this is not only due to financial problems, but due to a lack of good governance and organization, which was the topic of the Law of Health in 2022. So I suggest, as a member of the government, to actually obviously increase the percentage of yes.
Considering the importance of public trust in healthcare systems, how does the government plan to build and maintain trust, especially when there have been historical concerns about the efficiency of government-run institutions?
I didn't understand. Can you please repeat?
Considering the importance of public trust in healthcare systems, how does the government plan to build and maintain trust, especially when there has been historical concerns about the efficiency of government-run institutions?
The second part of my argument will answer to your question. So as I was saying, I suggest as a member of the government to obviously increase the funds dedicated to the healthcare system, as it will ensure a whole lot of improvements in terms of healing processes and healing services, sanitary transports, and obviously cures. And I also suggest setting up a healing process that will ensure and will have a better efficacy, and also by pushing therapeutic recommendations.
POI?
Yes.
How can a third world country finance totally healthcare while they have worrying debts?
Actually, in 2020, in the Law of Health in 2022, they actually mentioned that they have gathered more than 50 billion dirhams in order to satisfy the needs in the healthcare industry. And also, as I said, the repartition of this money comes, which is the problem, it comes directly from direct contributions, which is one of the major problems. And finally, by pushing prices references that should not be disconnected from reality. It will seem quite logical if I tell you that all of this requires money, a lot of money, and this repartition does not help at all. So, the respect of health processes, the application of great prices references and budget optimizations are imperatives. Thank you.
Please, before trying to ask us questions, revise the debate rule. Ladies and gentlemen, respected judge and two opponents, to confirm what our deputy leader of opposition said, let me tell you about how can the money earned from hospitals help the country improve its economy. Firstly, hospitals require significant financial resources to build and maintain infrastructure, buy advanced medical equipment, and provide quality healthcare services. The money they earn is very essential for improving and sustaining healthcare services. Secondly, competitive salaries and benefits that are funded by hospitals revenue can attract skilled healthcare professionals, including doctors, nurses, and specialists. This is crucial for maintaining a high standard of care and expertise within the healthcare system. Also, knowledge and technology, funding from patients' fees and services can contribute to research and development efforts. Yes.
You say that what you and your friends said is that some countries are really poor and cannot afford basic health needs to fund those expenses. But when the whole population is ill, isn't that the best investment that a government can do?
I will answer you later. And last the healthcare industry relies on rapidly evolving technology for diagnosis, treatment, and patient care. Revenue generated by hospitals allows the continuous of upgrading medical technology, developing the quality and efficiency of healthcare services. Our deputy leader of opposition talked about a poor nation. So let's talk about an advanced one. Let's take, for example, USA, which is the greatest economic power in the world. According to the report from the U.S. Health Department published in September 2017, 68% of American citizens had a private health insurance compared to 36% who benefited from public health coverage. Since USA is a country that never fully found healthcare, and by doing so, it became developed on medical innovation. The United States is a global leader in medical research and innovation. The profit motive within the healthcare system have led to significant investments in research and the development of cutting-edge medical treatments and technologies. Also, the USA has some of the world's top medical facilities and specialists, providing a high quality and specialist healthcare services. Patients often have the opportunity to secure the best expertise for their particular health conditions. Then, the private sector healthcare promotes innovation, competition among the healthcare that lead to better services and lower costs. However, the private healthcare system in the USA often emphasizes individual choice. Patients can select their healthcare providers. Thank you.
Honorable judges, dear opponents, most esteemed guests, greetings. At the very outset, I would like to begin my speech by asking you some series of questions. How can a country be civilized, developed, and advanced if it doesn't provide to its treasured and precious civilians health care? Or let's say, can you imagine a country where its own government doesn't see and esteem that funding healthcare services isn't that much primary, essential, important, and crucial to the point it lets private healthcare institutions take over the power, the strength, and the ability to do so? Moreover, how can some of you come and tell me that founding healthcare organizations isn't an obligation, but it is in fact a significant and major and momentous rules and launched and created by the Health World Organizations? Furthermore, you may and might come again and defy me by saying and stating that the private institutions are as good as the public ones, and even more, that they care and cherish passions as much as the government's healthcare organizations. Well, sorry to upset you, but you are absolutely and totally wrong and mistaken. However, don't worry too much, because I am here to clarify you, make you come to your senses, and put you on the right path. So, first of all, you should and ought to know that, generally and just logically speaking, most private healthcare institutions have one common purpose, reason, and motivation, which is to make money. Indeed, as you have heard, it is all about the world of business. That's why it is very possible and probable to come and find that almost all prices are atrociously high. Yes?
How does the publicly funded system prioritize patient choice in selecting healthcare providers, treatments, and specialists compared to a system where patients have more options through private providers?
Sorry, but no, patients have not more options for private institutions. There are a lot of poor people who, as I just said, don't find the opportunity to be treated. So, as I was saying, it is very probable and possible to find that almost all prices are atrociously high and unreasonable, especially for poor people who also need treatment and eventually have the right to profit from healthcare. To make it clearer for you, dear guests, let me show you a real and actual example, which illustrates completely my point, not accepted, which illustrates completely my point, and is related to the biggest industrial and the most powerful country in the world nowadays, which is the United States of America. Actually, the USA had adopted a system that strongly fortified the private healthcare institutions, and which is enormously inefficient. And here is how it goes. The USA spends around $6,697 per capita and gains less. So, to sum up, the USA spends a lot and gets less. The USA, which is the most dominant, controlling, and high-powered country in the world, faces numerous and complicated problems and issues regarding this system that our dear opponents have been from the very beginning defending in vain. Now, imagine Morocco, which is nowhere near the USA, adopts this system and therefore starts privatizing all the healthcare institutions. In your opinion, dear guests, how hard, intense, and problematic will be the economic consequences? How will all people, all social classes, without any exception, truly benefit from this? Thank you for your time and attention.
Ladies and gentlemen, esteemed judges, and their respected counterparts, allow me to delve deeper into the intricacies of Morocco's healthcare landscape. While recognizing the commendable strides made in our healthcare system, it's imperative to scrutinize the current capacity and resources of our hospitals. The concern arises when we consider potential limitations in infrastructure, advanced medical equipment, and highly skilled healthcare professionals. Relying solely on government funding might not provide the necessary impetus for these crucial improvements. Moreover, delving into the financial aspects, we cannot underestimate the potential strain on our national economy. A fully government-funded healthcare system could lead to budgetary constraints and hinder our capacity to adapt to emerging healthcare needs. Equally important is the burden on taxpayers, who may increase levies to sustain such a system. It's crucial to find a model that not only guarantees healthcare quality, but also ensures economic sustainability. In light of these considerations, we propose a nuanced approach that involves the private sector. Private investments can inject much needed capital into our healthcare infrastructure, fostering competition that drives efficiency, accountability, and innovation. A strategic public and private partnership rather than an exclusive reliance on the government funds ensures a dynamic and responsive healthcare system. This model not only enhances the quality of the healthcare and our hospitals, but also distributes the financial responsibility more equitably, creating a sustainable and resilient healthcare framework for the people of the world, especially the people of Morocco. Talking about the POI of earlier, I think if all city is ill, it's not going to be like an investment to the government, because as we know, there is a lot of problems that our hospitals face. So I think it's going to be completely chaos. Thank you.
Dear audience, fellow contestant, hello again. Well, I've passed around 50 minutes listening to you. The conclusion, you can obviously hear us, but you're not listening. Let me add more arguments on the fact that it's time for the government to finally take its responsibility to finance people's healthcare. Let me state the obvious. Government funding for healthcare significantly boosts economic productivity through various avenues. For instance, countries like Sweden or Norway, renowned for their government-supported healthcare systems, exhibit higher workforce productivity due to reduced sick leave and absenteeism. Employees in these nations are more likely to seek preventive care, leading to healthier and more productive workforces. Let us take Germany, for example, where the government ensures healthcare coverage for all residents. These examples underscore the pivotal role of government-backed healthcare in fostering economic growth and prosperity. Thank you.
First, I'd ask you to revise your sources. Dear Prime Minister, since Germany doesn't fully fund the healthcare system. Hello, here I am again, standing with even more confidence, since you, dear Prince, didn't do much except be totally unrealistic. Now, my time is running out, so I'll ask you for one last thing. Picture a public hospital. I know what you dear audience thought about. Chaos, many rooms full of patients, few doctors, and from one department to another, nurses, screams of pain, even despair. Despair, a very big word that I did not choose randomly, since all the patients suffering from different diseases came there, even though they knew they would have to wait an eternity to eventually have an appointment after weeks, if not months. Believe me, if the government fully funded the healthcare system, the situation would grow any better. On the contrary, it would worsen. Thank you.
Very dear opponents and audience, I'm back again, and I suggest we dissect the economic argument a bit more. Just in case, you know, what we have advanced earlier was not persuasive enough, which I strongly doubt. Some may argue that government-funded healthcare is an economic burden, but I pose this question to you. What is the true cause of a population's ill health? When preventable illnesses go untreated due to financial barriers, the long-term economic impact is staggering. Productivity declines and the burden on the workforce increases as preventable illnesses become chronic conditions and diseases. By investing in healthcare, the government is in fact investing in a healthier and more productive society. Now, consider the burden placed on emergency rooms when individuals without access to primary healthcare only resort to seeking help when their conditions have reached critical stages. This not only impacts the healthcare system, but also inflates costs. So would it not be more fiscally responsible to fully fund those expenses and invest in preventable measures and early interventions which are more cost-effective in the long run? Thank you.
Good morning again. I see, dear opponents, that you're mainly mentioning the third world countries, while neglecting that our debate's topic is stated in the general run of things, which means we will need to treat the whole world situation. But since you already proved enough times that you can do logic, then I hope you can do some maths at least. Yes, maths with a simple following equation. Privatization of healthcare equals letting healthcare companies take care of their specialties, which is healthcare, which equals competition between them, which equals, again, quality of healthcare increases. On the other hand, the enormous budget that was once used or consumed for healthcare will be now consumed by mainly education, which equals developing education and making it within reach for everyone, equals the return price for healthcare reduces, which finally equals private healthcare will be in everyone, rich and poor. Thank you.
Ladies and gentlemen, don't forget to mention that the 8 million deprived citizens that was targeted by the Ramed has moved to 16 million citizens in the last 2 years. And with only 10 million of them going to claim their Ramed card, with the others judging it too low to even try. How is that not a shame when people just stop trying to resist, knowing for sure that the help that will be presented will be useless? How is that not a shame when pregnant women has to give birth to a child in the hospital bathrooms due to the lack and the absent utility of their health insurance? How is that not a shame when people are agonizing in their deathbeds due to the lack of professionalism and equipment in their region? How is that? The public sector has to get back its real place among our health system. And we need to sign the partnerships, the public and private partnerships that we have been talking about for 10 years. Today the government is more true than ever. So why don't we just step into this project of upgrading our life conditions? Thank you.
I think I have to say more than once. Revise debate rules. Dear audience, student opponents and respected judge, greetings again. As I mentioned earlier, now the developed country neither the parents can finance healthcare. Especially that we are living in a capitalist world. And the idea of fully found healthcare is impossible and imaginary. Let's take, for example, Singapore. Singapore is a country that has the best healthcare in the world. Unlike the healthcare system in many socialist nations, Singaporeans cannot walk into a clinic or a hospital and have the treatment for free. So let's talk logically. Healthcare cannot be funded by the government.
Here I am again, dear guests. First of all, I invite you to revise your sources. Dear guests, to continue proving you that indeed Morocco should gigantically fund all healthcare services on the ground that Canada, one of the most successful, progressive and exemplary country in the world, had known in the past few years a big and remarkable flourishment and embellishment. Now, you might ask why. It is because the government has established and adopted a system that enables and allows civilians to have a reasonable access to medically necessary hospital and physician services. How wonderful, you may say. Well, let me tell and assure you that it will be much more marvelous and delightful if our own government acquires this system fully and our esteemed opponents finally acknowledge, confess and admit that this is the best and the most humanitarian resolution ever. Thank you for your time and attention.
Revise my sources? Not very specific. I don't think so. Thank you for this engaging debate. To reiterate, we firmly oppose the position of full government funding for healthcare. Our arguments highlight potential taxpayers' burdens, risk of inefficiencies in the government system, and the crucial role of the private sector in fostering innovation. We advocate for a balanced healthcare approach, promoting collaboration between public and private sectors, ensuring a responsive and sustainable system for the diverse needs of our citizens. Let's move forward with a vision that combines accessibility, efficiency, and innovation, care for our healthcare landscape. Thank you.